Judson Brandeis, welcome to the Orgasmic Lifestyle Podcast, where everything
Oh,
is the
Venus.
climax.
Yeah, Venus. I can't wait to climax with you.
Amazing. When I heard about this topic, I was so intrigued. So, for those who are unfamiliar with your work, could you tell us what you do?
Oh, I do a lot of stuff actually. So I'm a board certified urologist. I've been in practice for almost 25 years. I started out really interested in prostate cancer. I helped pioneer surgical robotics. I built kidney stone centers. I helped pioneer MRI guided prostate biopsies. And then about 5 or 6 years ago, I became interested in regenerative urology. So the ability to help men who no longer were able to get erections to be able to get natural and normal erections again. And so I helped do research in low intensity shockwave therapy and platelet rich plasma. And one of my recent projects has been P-Long, which is the first natural way to and totally safe way to increase the length, girth, and function of a healthy man's penis.
This is the biggest question that people ask all the time. So, what inspired you to follow this path?
I love being on the bleeding edge, not just the leading edge, but the bleeding edge of technology. So when I was doing surgical robotics, I was doing it years before the private practice guys. We had the second Da Vinci surgical robot in the country. I started doing MRI guided prostate biopsies when the academic guys were doing it, and um, I just like having the tech that no one else has.
So, I imagine you studied medicine and then you went into this particular specialty. Why this specialty and not something else?
Because it makes a huge difference in men's lives. It really
Mm.
does. I mean, I would cure someone's prostate cancer or kidney cancer, and the patients would come back and say, "Oh, thanks a lot, doc. I appreciate it." But when a man hasn't had satisfying sexual relations with his partner for 5 or 6 years, and you're able to give that back to him, uh, he's your friend for life. I mean, it's amazing the stories that I get, and people are just crying in my office and just deliriously happy, and you know their families back together and their partnerships back together. It really is very gratifying being able to help men do that.
Amazing. So, tell us, what is the P-Long protocol?
Yeah, so I mean, like I honestly, as a total disclaimer, I could care less how long guys' penises are,
Okay.
right? The function of the penis is procreation and
hmm
urination. And if you can procreate and you can urinate, your penis is just fine,
hmm
right? But 300,000 American women each year get breast implants, right? And not all of them have breast cancer. So people just want things that are bigger and better. And so I would see guys in my office that had either fillers or fat transfers or ligament ligations or the pneuma implant and have horrifying complications. And I just decided, listen, there's got to be a better way. And I've done research at American Red Cross with the guy that figured out how to freeze blood for transfusion. I had spent a year at Harvard Medical School with a Howard Hughes Medical Institute fellowship in the lab where they did the first living related kidney transplant. I did a year of outcomes research with Mark Litwin at UCLA. So I have a lot of research background. And I was doing research in my office, and I figured there's got to be a better way to increase the length, girth, and function of a healthy guy's penis. And so I wrote a research protocol. I got it IRB approved, which means that there's an institutional review board looking at the research that I'm doing. I had it listed by clinicaltrials.gov, which is the NIH website. And then I did the research. It took about 2 years. We had 30 patients in the study. I presented the results at the Sexual Medicine Society of North America and the International Society of Sexual Medicine. So these are all the academic urologists that focus on sexual medicine. So it's really vetted by the top people in the world because sexual medicine is just filled with people making outrageous and ridiculous claims. And so, my study has been vetted by the top people in the world, and then it's published in a reviewed journal called Andrology. And all that information is available on our website, which is p-long.com. So, the point of it is so many people out there say, oh, you take this pill and you're going to perform like a porn star, your penis is going to be 16 inches long. Like, I mean, we all know that's bullshit, but can I curse on your show?
A little bit, not too much.
Okay, not too much. Okay.
Okay.
We all know that that is
Mm,
uh,
not
made up
true.
stuff.
Yeah.
Not true. But like the P-Long has been vetted, and I'm a real person and I have real credentials, and we have real results. So the results we got were, on average, men's penises grew 0.8 inches, about
Okay.
15% of where you started in length, about 10% in girth, and everyone had improved erectile function.
So what kind of is it something like they would go to you for a visit and there's a procedure, or is it something they do at home? What is it exactly? What is
Yeah,
the
so it's a combination, and we have 50 or 60 providers around the United States and a couple international.
Mhm,
So you don't have to fly to San Francisco, although it's really nice out here, but
mhm,
you don't have to fly all the way out here to see me. You can fly to see someone else who's trained in the P-Long protocol. But basically what it is there's a traction device called the RestoreX device, developed by a friend of mine at the Mayo Clinic. And you use that 20 minutes twice a day, and that's for length.
mhm.
There's a penis pump developed by the Dr. Joel Kaplan people, and that's for girth. And you use that 12 minutes in the morning and 12 minutes in the evening. And then you take the Affirm nitric oxide boosting supplement. It's a supplement that I formulated that boosts nitric oxide, which boosts circulation. And then the secret sauce is PRP. So PRP is platelet-rich plasma. So the platelets in your blood contain clotting factors, right? Everyone knows when you cut yourself, platelets go there and they release clotting factors and they cause a clot. But the other thing platelets have are growth factors. So
Mhm.
that's the reason when you cut yourself, you heal. It's because all those growth factors get released and heal up the wound.
And how many sessions would it take to start seeing results?
Yeah, so it's a PRP injection once a month for 6 months.
Hmm.
And the patients start seeing results within the first 2 or 3 months. Um, I laid out all the curves of all the patients to see if there was a trend, like, are people growing more in the first 3 months, or people growing more in the second 3 months? And there wasn't a clean distribution on those curves. So some people grow early and then plateau, and some people grow uh, late. So the first 2, 3 months, they're looking at me like, Doc, how come nothing's happening? But then the last 4, 5, 6 months, uh, things are growing better. And then the thing is, I had to artificially set the end of the study at 6 months, because once you have statistical significance of data, then there's no reason to keep
Hmm.
going on the study. You write it up, you publish it, et cetera, et cetera. So, but I had many of the patients in the P-Long study continue on month after month after month, and they continue to get gains. And so, that's the real benefit, is if you're 6 inches and you want to get to 7.5 inches, you're not going to do that in 6 months, but maybe in a year, maybe in a year and a half, you're going to be able to achieve your goal. And then I had a patient that came in the other day, and he's like, Doc, uh, I love you. This has been great, but I'm not going to come in anymore. And I'm like, how come? You've been doing so amazing. And he said, well, my wife said that I'm too big for oral and I'm too big for anal, and I need to leave at least one orifice open.
Okay. So we're talking this increase is erectile length or flaccid length.
Erectile length, right? Flaccid
Okay.
length is totally variable.
Okay.
You know, if you just come out of the cold ocean, you're going to
Mm.
be really, really small. And if you're in the room temperature room, you're going to be a little bit
Mm.
bigger. And if you're in a sauna, you're going to be bigger than that. So flaccid length is very variable, but erectile length is pretty consistent whether you're in a cold pool or a hot sauna.
Mhm. I've made some videos on my YouTube channel about does size matter? Of all the questions that I get, like for women, it's always how can I have an orgasm? And with men, it's always about penis size. And some people have even asked me if like they could send me a picture for my opinion, not even just trying to send a dick pic, but they actually are genuinely worried. And it's so interesting because there's so many. There's so a lot of complexes around this topic. Even the big guys, so people think that bigger is better, but even those guys are complaining that their partners are, talking about pain and it's uncomfortable. So it just seems to be on each side of the spectrum. There's a lot of
Yeah, and that's really interesting you
comfort.
bring that up,
Mm.
because in the P-Long study, it wasn't like all guys with small penises.
Okay.
A third of the guys had small penises or like less than average penises. A
Mm,
third of the guys had average sized penises, and a third of the guys had penises that were above average.
mm,
So it's not a question. It's like all beauty's in the eye of the beholder, I guess.
mm. But I think
But the
also,
thing is, I want people to do it in a way that's safe.
mm,
I've seen way too many men who've had fillers or pneumas or fat transfers or ligament ligations, and they take a perfectly normal penis and they ruin it. They destroy it. And that honestly, it was almost like a public health initiative, Long. Like I
uh-huh.
just didn't want to see another guy look at me with these sad sack eyes saying, I wish I had never done that before. And with Long, I've never had that happen. With the 30 patients in the study and the dozens and dozens of patients that I've seen since then, it's very safe. Nitric oxide boosting Affirm is totally safe. PRP is your own platelets injected with a 30 gauge needle. It's totally safe.
Mm,
The traction device and the suction device, totally safe. Nobody gets hurt. Your penis will be longer, it'll be thicker, and it'll work better because PRP, right, is just growth factor and it helps you grow blood vessels in the penis, and those blood vessels will give you better, more rigid erections.
okay, that's what that comes to my next point actually, because people when they ask me, does size matter, blah blah, I always have replied in my videos that it's not really about the size, it's about erection quality. And I think that's a really big thing. That's probably a really big thing, literally. It is like more important to have a good quality erection. One of my friends who's Spanish says like the leg of a table, you know.
Exactly. Well, it's not the size of the nail, it's the hammer that drives it.
Yeah, and you just notice more. I mean, I remember, well, I just remember once I was kind of in a situation with two different guys, and one was kind of quite big, but not super hard. And the other guy was smaller and much harder. And I just felt so much more like with satisfaction with the smaller guy. So it was very interesting. It wasn't so much about the size at all. It's more that kind of tension that was. I think it's also, I think guys get the raw end of the deal here with this topic. So I do think it's about the fit, it's about,
Mhm.
because I think it's about the jigsaw effect if it's working or not, with that
Well,
penetration.
I mean, from the woman's perspective, I mean, who wants someone banging on your cervix for a half an
Mm.
hour? You know,
Yeah.
you you'd rather have uh, a fit, even a smaller penis. You probably get more clitoral stimulation from
Mm.
a guy with a slightly smaller penis,
And also, what's funny
because
is, well, I've spoken with female friends about this. When guys feel bad about the curve, we're like, we want the curve, we like the curve. I mean, most sex toys do have a curve, because that's
uh-huh.
for a reason, because it does feel nice. So I think a lot of guys don't feel good about that. But I think these insecurities, I would say they're coming from porn. Where would you say they're coming from, and what? I mean, do you think it's always been like
Yeah,
this?
I mean, I think it comes from porn. I think it comes from the locker room. I think it comes
Okay.
from sort of like mean-spirited, frustrated partners. I mean, I ask guys, like, why are you interested in doing this? And when you get right down to it, sometimes guys will say, well, like an ex-girlfriend said, well, you weren't as good as my ex-boyfriend who had a bigger penis than you are. And, something like that sticks in people's brains, or, you know, I remember one guy said, ninth grade, I was coming out of the shower, uh, and, guys were laughing at me, and that really stuck in their heads. So, and then of course, there's a glorification of large penises on porn, and,
Mm,
that's it's detrimental, but that's just the way it is. You watch movies and you see, James Bond or these kind of characters that are doing things that normal humans can't do.
mm,
And we kind of take it for granted, like, oh, I want to be like James Bond. Well, no, I mean, that's totally unrealistic too. So it's not just pornography that gives people an unrealistic view of what humanity should be like. It's modern culture, I guess.
mm. Yeah, and that's really cruel to say.
I
Just
won't get it. I won't get
yeah.
philosophical on you anymore. We can
Yeah.
talk about penises and sex.
Okay, so tell us about some maybe dangerous things that you've seen people do to increase their size? You think people using, what's the craziest thing you've heard?
Oh, I've seen, well, I mean, one thing people have done is inject silicone
Oh,
into the
wow.
penis, which is really, really super detrimental. Um, a lot of people do jelqing, which is like a hand technique to pull the penis out,
Okay.
or they use traction and suction devices. But there was actually a study done about 20 years ago by a German company making, I think it's called the Andropeyroni disease, device, but they kept it on for 8 to 10 hours a day for 8 months.
Oh,
And that
wow.
was how they got an inch in length, which, I mean, I guess you can do it that way, but most people don't have jobs where you can put a device on for 8 to 10 hours. That's the beautiful thing about the P-long study is that it's a half an hour in the morning, half an hour in the evening. You get a P shot or a PRP injection once a month for 6 months, and you're good. And you don't have any foreign bodies, right? So I had a patient that came in that had a pneuma device, which is like a
What's
silicone
a
taco.
pneuma? Oh,
Yeah, pneuma is like a silicone taco that they surgically put over the erectile bodies and under the skin. And
uh-huh.
this guy was like a 25-year-old, otherwise healthy guy with a reasonably normal penis. And then he got infected. So he was in the hospital for a week. Then he had to have it taken out. Then he had to have two other corrective surgeries, and he's still not normal. So here's a guy, 25-year-old healthy guy with a normal penis that functions just fine. He can procreate, he can urinate. And now he's had 4 surgeries. It's cost him a boatload of money, and he's got a messed up penis,
Wow. The
right? And
implications are
that's just,
huge. Mm,
yeah. I mean, it's really sad.
mm,
It's really like that's tragic that somebody felt the need to do something to get a bigger penis for whatever reason, and it ended like that. Whereas if he had done P-long, he would have gotten maybe an inch in length, a half an inch in girth, better function, and absolutely no risk of
mm.
any problems.
Speaking of young people, I've read that PIED is the most common form of erectile dysfunction these days, like porn-induced erectile dysfunction. Do you know anything about that? About these issues? Because you mentioned earlier before we got online about the aging person who's,
Yeah, I mean,
weight
like
and
I've certainly seen some of it. I
mhm,
haven't seen a lot of it. I mean, cardiovascular disease, I think by far is the
the culprit.
the preponderant cause of erectile dysfunction in men over 50, but I would say probably porn-induced erectile dysfunction is probably a vast majority for men under the age of 40. And
Mm,
the thing is, like, men are stimulated in 3 ways: tactile,
mm,
fantasy, and visual, right? So um, tactile is tactile, but if you start out watching Pornhub and you see a man and a woman, then a man and two women, then a man and 10 women, then a man, 10 women and a donkey, and then man and 10 women and a donkey and, whatever. Like you totally become desensitized from both a visual and a fantasy standpoint, so that whatever real life is represented now
mm.
isn't realistic anymore. It's like watching NBA basketball and then thinking like, well, if I watch NBA basketball, I'm going to be as good a basketball player as LeBron James. Like,
Mm.
I'm sorry, it just doesn't work that way.
It's like when you think about the cavemen, how many women did they see a day? You know,
Oh
compared to
yeah.
now, in the smartphone. It's
Well, I
just,
mean, I mean, animals, they only look at women when women are in heat.
yeah.
That's it. I mean, there's like a hormonal cycle
Mhm.
that says I'm available, and otherwise you better get the hell out of the way because you're going to get, you know, bitten or clawed.
Wow. Wow. So another thing about penises, I remember once I interviewed this guy who had had phimosis up till adult age. I think like for women, usually, we're kind of more used to going to the doctor, the OB/GYN, the gynecologist to show our bits to doctors, but I don't think men have that routine checkup in the same way as women do. And I've had friends who've, they've got this really serious case of phimosis and they can't have sex, they can't masturbate, but they're just too ashamed to go to the doctor to sort it out, and they miss out on all that part of life, like the the intimacy.
Venus, I couldn't agree with you more. It's really
Yeah,
tragic how
really.
men are afraid of doctors.
Mm,
Statistically in the United States, men go to doctors less than half as women. And you hit the nail on the head. Women go to their OB-GYNs. And the
mm,
other thing is women are much more likely to bring their kids to the pediatrician than their husbands. And so, they actually know where the health insurance card is. They
mm.
know if they have a PPO or an HMO or whatever. I mean, in Europe, you guys don't have those kind of problems. In the United States, we don't have public health insurance, and so it's the craziest, most horrible system, pretty much. Um, and so men don't go to the doctor. You're 100% right. And even, there's so much BS information out on the internet. I remember I had a patient, this was like 5 or 10 years ago, really smart kid, was going to UC Berkeley. I saw him before he was going to college, and he had phimosis, couldn't pull his foreskin back. And I said, dude, you need a circumcision. He's like, well, I read on the internet that it hurts really bad. I don't want it. So I didn't see him. All of a sudden, he shows up 7 years later. He had gone to undergraduate and law school. And he's like, I still can't pull my foreskin back. Uh, you know, can I get a circumcision? And so I said, sure. So I did a circumcision. He came back 2 weeks later and he was like really sheepish. And I said, what's wrong? He said, I can't believe I didn't have a circumcision 7 years ago. He said, I went through college and law school and didn't really have any satisfying sexual relations because of my phimosis. And he said, I didn't have any pain after the procedure. I didn't take a single pain pill.
That's amazing.
Yeah.
Yeah, wow. I guess it depends on there's different grades of phimosis as well, isn't there? Like different severities of it. Because I remember
Oh,
I've had,
I mean, the circumcision's all pretty much the same. It's
yeah,
a
I had a
very,
friend who was completely covered, like the head was completely covered, so they couldn't put it down at all, like zero. And that's kind of an extreme. And I have because normally in the States you actually that's happened that's with babies that they are circumcised. Is that still a practice?
it's pretty common to get
Mm,
circumcised when you're a baby.
mm.
And,
Not here.
yeah, I mean, you basically significantly reduce the risk of infections and urinary tract infections, uh, penile cancers. I mean, penile cancers are rare, but you never get those with the folks that are circumcised.
Oh,
And
really?
I'm not saying that you have to get circumcised, but if you don't get circumcised, you do have to know how to take care of your foreskin.
Mm. And that's a problem because
Keep
like
it.
well, I guess mothers don't really know how to teach their sons to like
No,
pull the skin back, wash it, put it back again. There's still that shame involved.
yeah, absolutely.
Yeah.
I mean, that's the problem with penises and with erectile dysfunction. I mean, say you're at work and your father has heart disease and needs to go to the cardiologist, right? So you tell the people at work, listen, I got to take my dad to the cardiologist. He's, 85 years old. He's having some heart problems. And everyone in the office is like, oh, that's so nice. You're taking your dad to the heart doctor. That's just amazing. You're a good son. Then, a week or two later, you're like, guys, my dad has erectile dysfunction. He can't knock up my mom, and I need to take him to the urologist. Do you mind if I go? And people aren't going to be like, "Oh, that's so amazing." You're helping your dad get an erection.
Mhm.
But it's the same disease process, right?
Mm.
Cardiovascular disease and erectile dysfunction are the same process. It's just a different organ.
Isn't it one of the first signs of heart problems that I've read?
Absolutely. Absolutely.
Mhm.
So the thing is, the arteries to the heart, the coronary arteries are 3 to 4 millimeters, and they're one of the first things in your body that gets blood. The arteries to the penis are 1 or 2 millimeters, and they're at the periphery. So you're going to get erectile dysfunction 10 years before you get heart disease. And actually, the first sign that circulation isn't as good as if you lose morning erections. So if
Oh,
you're not
wow.
getting morning wood anymore, your blood vessels are starting to get clogged, right? Because erections are totally a function of blood flow. The
Mhm.
penis is the only organ in the body that moves entirely based on blood flow, right? It's the only organ in the body, that basically is just skin and vascular smooth tissue, smooth muscle tissue. And so if you don't have good circulation, you're not going to get morning erections. So 10 years after you lose morning erections, you begin to lose daytime erections or erections on demand. And 10 years after that, you may have a heart attack, you may have a stroke, you may need an angiogram. You're going to have some of those problems. So it's Mother Nature's giving you a warning sign
Mm.
that stop eating too much, stop smoking, stop drinking, start exercising, start meditating, start stretching, start doing yoga, start eating better, get on a statin. I mean, there's so many things that you can do to improve circulation. Get on a nitric oxide booster like a Firm, maybe take a baby aspirin. I mean, so many things you can do. But you actually have to go to the doctor, or at least listen to a podcast like yours, or go to my YouTube channel. Or there's so much information, good information out there. Just find a good source of information and start actually doing those things.
I went to this sex tech conference last year in Berlin, and Firm Tech were there. I interviewed Dr. Elliot Justin, and he showed this
Yeah.
about the different ages and erectile dysfunction. It's like 50%, 60%, 70%. I was like, oh my God. But as soon as I saw that graph, I thought, I've got to interview this guy. But how can men approach aging and maintain erectile function? Is that
Yeah,
something?
well, I'll tell you a quick story first. So I know Elliot really well, and
Mm,
he and I just collaborated on a study called the Confirm-1 study, and I'm going to present that study at the Sexual Medicine Society of North America meeting in a week in Arizona. And what we found using the FirmTech ring, so the FirmTech ring is a ring that goes around the penis, and it measures pressures.
mhm.
And when you get erections at night, you measure it as pressure. And in a healthy man, you should get 30 to 60 minutes of erections every night. And so what I did is I wanted to prove that the Affirm nitric oxide booster improves nighttime erections. And the way it does it is nitric oxide in your body creates something called cGMP, and cGMP opens up blood vessels. So if you take Affirm before you go to sleep, theoretically, you should get better nighttime erections. So what we did is we had subjects who were patients in my office wear the ring 2 nights, not taking Affirm, and then the next 2 nights while they took Affirm. And what we found is 33% improvement in nighttime erections over not taking Affirm,
Wow.
which is pretty amazing because it's a totally safe supplement,
Mm,
right? And the only reason that drug companies aren't bottling it and selling it is because you can't patent it, right? It's watermelon and beets, and it's been in the public domain since it was discovered in 1998 at UCLA, where I was in residency. So, but I use it as a blood pressure medication. People use it for athletic performance. Bodybuilders use it. Elite endurance athletes use it. It improves cognitive function,
mm,
right? If you're over 60 and you're not thinking quite as sharp, take 2 tablets of Affirm in the morning, 2 tablets of Affirm in the evening, and it will improve blood flow to the brain. The brain is very sensitive to oxygen consumption and glucose consumption. And so if your circulation is able to deliver oxygen and sugar to your brain, you're going to think better. I mean, it's not magic, but anyway, the reason I brought that up is that Elliot and I collaborated on that study, and he's on that abstract. And the really, really, really cool study I'm doing right now is the Confirm-2 study, right? Because I'm going to teach you a little biochemistry if you don't know it already,
mhm.
right? Nitric oxide makes cGMP, cyclic GMP, and cyclic GMP opens up blood vessels. Okay. And when I was at UCLA, my friends and professors discovered that there's an enzyme in the penis called PDE5. And the reason it's so amazing is that PDE5 is only in the penis. So there's other PDE enzymes all throughout the body. So like there's PDE1 in the brain, there's PDE6 in the eyes, which is why you get bluish haze sometimes when you take Viagra. There's PDE4 in the lungs, which is why you can use Viagra for pulmonary hypertension. But PDE5 is in the penis. So if you block PDE5, then you keep cyclic GMP available and you keep blood vessels open. right? So theoretically, there should be a synergistic relationship between a PDE5 inhibitor and a nitric oxide booster. But there's only been one study ever written, and it was done using purely subjective data, meaning that they asked questions to the subjects like, rate your erection 1 to 4, right?
Mm.
Which is really totally bogus because you could have a great night the night before and it would be a 4, and you could have a lousy night the night before and it would be a 1 or a 2, right? What you want is purely objective data. And that's what the FirmTech ring provides, is purely objective data. And so what we're doing is for 2 nights, you take 40 milligrams of Viagra. So a full dose of Viagra is 100 milligrams. So you're not taking a full dose. You're just taking like a 40% dose of Viagra. And then the next 2 nights, you take 40 milligrams of Viagra and 2 Affirm tablets, right?
Is it
So
the firm that's behind you? That's the supplement that you have created.
yeah, this is the Affirm right up there.
Okay.
And what we've found, because I did the first, I'm always the guinea pig, um, is that there were dramatically better erections when you combined a nitric oxide booster and a PDE5 inhibitor like Viagra. And this is going to be really, really important when we finish the study and we present it and publish it, because the thing is, a lot of guys can't take a full dose of Viagra because they get headaches or facial flushing or stuffy nose or reflux. There are a number of minor but irritating side effects from taking Viagra. And
Mm.
so if you can't take 100 milligrams, but you can take 50 milligrams, and then you take a bunch of Affirm, which is a totally safe supplement, with the Viagra, you'll be able to achieve almost the same results as maybe you're taking 80 or 100 milligrams. And so that's going to really help. I mean, there are literally millions and millions of men worldwide that can't take full doses of PD5 inhibitors because of side effects, and they're going to get the benefit of a combination.
Wow. So I actually read somewhere that there's I don't know if this is true, you can tell me if I'm right or not. There was like a classification of 4 levels of erection quality. Is that correct? Like there's like
Well,
level
there's,
4 would be
yeah,
like
I
you
mean, the
don't
thing is,
penetrate, and then 3 almost, and then 1 and 2 just a bit of swelling.
yeah, I mean, so it's really interesting doing research in sexual medicine, because erectile function is a function of physiology, but it's also a function of psychology and
Mm.
stress. Like, I mean, you know that as well as I do. And so, you could have great um, physiology, right? Great blood flow. But if you have anxiety, if you have depression, if you have stress, your erections aren't going to be strong.
Mm.
And so that's what makes it really challenging. And so you can ask questions, but sometimes they don't really give you the right answer, um, in terms of what someone's physiologic potential is. And then the other thing we can do is use an ultrasound and look at blood vessels, but we're injecting a medication into the penis to stimulate an artificial erection and then measure blood flow. But still, these are 1 or 2 millimeter arteries, and it's very difficult to sort of standardize um, what we call the peak systolic velocity, how fast the blood is pumping into the penis, and the end diastolic velocity, which is how quickly the blood is flowing out of the penis. So if you've heard of a venous leak,
Mm.
right, your end diastolic velocity should be close to 0, right? Because you should be pumping blood into the penis and there shouldn't be much blood trickling out. But if your end diastolic velocity is 6 or 8 or 10, it means you're pumping blood in, but you're not trapping it in the penis and blood is trickling out. So, I
Does
mean,
that mean
those
you're
are,
losing the erection?
yeah, exactly.
Uh,
So that's a guy that's has a full penis, but not a rigid erection. It's he's leaking blood out of the penis, or a venous leak.
Is that something
Uh,
that's health related? Could you improve that with diet, or
well, I mean,
is it just an
to
aging?
get,
Mm.
I to my patients and on podcasts, I say I can get you healthier than 95% of men in 10 seconds.
Okay.
So don't drink, don't smoke, don't eat too much, exercise every day, don't eat too much cholesterol, get good sleep, do yoga, uh, stretch every day, and be nice to other people.
Uh-huh.
Right? If you do all those things, you're going to be healthier than about 95% of people, and you're going to have better erections because you're going to have better vascular flow.
So I'm interested in how can you get up being nice to other people can make you have better erections? Is that just like from
Oh,
a
because
stress
it, well,
perspective?
no, yeah, it's from a
Yeah.
stress perspective. I mean, there was actually a really, really interesting study done at Harvard. It's a very famous study. It's been out now, I think, 80 years. There's a great TED talk by the guy that runs it. And they followed, I think, 100 Harvard students and 100 kids from Southie, which is kind of the poor part of Boston. And they followed these guys every year, twice a year. And then they followed their children and their children's children and their children's children. And what they found is the most important predictor of health and happiness was the quality of your relationships.
Oh yeah, sure.
The, it's more important than did you go jogging every day, or did you take an aspirin, or did you take whatever,
Mm.
the quality of it. So that's why I include that.
Amazing. That's a good. Obviously, you got to enjoy the erection as well. I mean, what's the point of all
Exactly.
that? All that pain and intervention.
Yeah, all that work and it's all dressed up and
Just to
no place to
masturbate.
go. Yeah.
Tell us, I can see your book in the background, 21st Century Man. What is that about?
That is the most comprehensive and medically accurate men's health book ever written.
Hmm.
So it's 101 chapters, over 900 pages, 60 co-authors, and it covers every aspect of men's health, from physical health to specialty health to addictions to aesthetic health to sexual health to lifestyle to mental health. There's sections on relationships, depression, anxiety. Um, there's sections on health insurance. And it's written, I write basically for men.
Mm.
So it's very, very information dense. So like I have this thing called Blink. It like summarizes a 400-page book in 15 minutes. Like this is a 40-hour audiobook, and you couldn't summarize the audiobook in any less than 40 hours. The way I write is very, very information dense, right? So, but each chapter is only 5 or 10 pages. So if you
Okay.
have an issue with your prostate, read the prostate chapter. If you have an issue with hair loss, read the hair loss chapter. And the hair loss chapter is written by Miguel Canales, who's one of the top hair loss guys in the country.
Okay. Is that
Yeah.
related to testosterone?
Yeah, there's a great chapter in the book written by Gary Donovitz, who's the founder of BioT, the biggest testosterone replacement company in the country. But testosterone is converted in your body into dihydrotestosterone, DHT. And DHT has a tighter binding affinity, meaning it binds more tightly to a testosterone receptor, activates the testosterone receptor, and it's particularly important in the prostate because it causes benign prostate growth, but also it causes male pattern hair loss.
Oh, wow.
So the medications for hair loss include a medication called finasteride or Propecia. And what that does is it blocks the conversion of testosterone into DHT.
I'm the opposite to you. I'm a very unscientific person. I just written this book called Orgasmic Manifestation, which is about um, techniques about how to channel or harness sexual energy for manifestation. And I discovered this when I read Napoleon Hill's Think and Grow Rich. He talks about sex transmutation, which is a really big topic. And I'm quite spiritual as well. And this podcast is quite spiritual. And I always get this question, can men do this? And I think there's this idea in the spiritual world that you're losing energy if you ejaculate. But then I've heard urologists say you should, ejaculate 21 times a month just to kind of keep the pipes clean, or kind of thing. So what would you say to that? What about how ejaculation and health and prostate health in particular?
Yeah. So I am very cognitive, logical, scientific, but I'm really trying hard to be more emotional, more spiritual. I think that a lot of us in medicine and scientific disciplines don't do enough of the the spiritual and emotional aspects of things. But from a purely urologic scientific perspective, it is important to ejaculate and keeps the pipes flowing, because when we do prostate surgery, where the prostate gets too big and we start to scrape away prostate tissue, you'll see calcifications, almost like gravel, that
Oh,
form on the inside of the prostate that blocks the ejaculatory duct. So it blocks the duct going from the seminal vesicles out to the prostatic urethra, so that when you ejaculate, especially, I get complaints from many men over the age of 50 or 60 that their ejaculation isn't nearly as strong. And part of that is because the ejaculatory ducts and the prostatics are blocked by these calcifications, and they can get pretty heavy. And when we do ultrasounds, and I've done thousands and thousands of ultrasounds in men's prostates, you can see, they show up as white in the prostate. And so many, I'd say, if I were to guess, 40-50% of men over the age of 60 have prostatic calcifications. And I would say that it would be much less likely if they formed if men ejaculated. I don't know if 21 is a magic number, but you
it
know,
depends on the age, maybe. Does it depend on the age?
no, I don't think it depends on the age. I think it's just a frequency of ejaculation every 2 or 3 days. I think it's healthy
Okay.
to ejaculate every 2 or 3 days.
Yeah, because I have a lot of friends doing no fap. And I think for someone either sexual wellness, I mean, obviously masturbation is a big part of my work, particularly female masturbation. And I think a lot of men, I'm not really a fan of porn, but I think a lot of men equate masturbation to porn consumption. So they want to get away from the porn consumption, but so they completely shut down on masturbation. And I would like to propose you can masturbate without porn, maybe, and then you keep the pipes clean and not have that damaging your brain or that imagery or kind of having those effects on you like we talked about earlier about the caveman compared to what people are seeing.
Yeah. Well, I mean, if you don't
Mm,
drink, don't smoke,
mm,
eat right, exercise, and you're
mm,
nice to other people, you'll probably
mm.
have some partners and you won't have to
Yeah.
masturbate. So,
Yeah.
you know, that's a way better option than doing it on your own.
Yeah, yeah, for sure. Great. This is so interesting. This topic is very interesting. So what are you working on right now? So you mentioned the study that you're doing.
Yeah, I mean, I have the Confirm 2 study, which is a
Mm,
combination of Affirm plus Viagra. That's going to be super exciting. Let's see. I'm working with a company called Morphometrics on a microvascular ultrasound technology to look at the growth of small blood vessels in the penis after regenerative technology. So after using low intensity focused shockwave therapy or platelet rich plasma or stem cells, you want to be able to assess the response to treatment. And if you basically rely on asking people like, well, did you have better sex last week?
mm,
It's incredibly variable. Sometimes people will be like, oh, my wife had surgery, or my wife was away, or who knows.
mm.
um, so it'd be nice to have a um, a really accurate way of assessing the growth of new blood vessels. And so we're doing some really exciting work, and we're collaborating with Baylor University on that. And then let's see what else I have. I'm developing a new technology for the treatment of Peyronie's disease, which
That's
is
the
really
curve, isn't
exciting.
it?
Yeah, that's the curve, because it's really the only technology out there currently is a medication that costs about $40,000 for a full course of treatment.
So what's the
And
difference
most
between
concern,
the curve, just like a normal curve, and then this disease? Where
Oh,
does it become?
it's scar tissue. So it's a
Okay.
pretty southern curve. And I can get guys with 60, 70-degree curves that, you know, you wouldn't want to have sex with, because it would be uncomfortable for you and it's
Uh,
uncomfortable for them.
okay. It's painful, I guess.
Yeah, painful
Uh,
for everyone.
okay. So it's a question that I ask everybody. What is the book that changed your life?
Well, the one that I wrote, because it took about
Mm.
2 years of my life.
Okay, definitely.
Yes, yeah.
That was been interesting to collaborate with all these people. Was there any anecdotes anything you learned yourself that
Oh gosh, I mean, I learned so much. I mean, I learned about diet, I learned about exercise, I learned about we have amazing chapters on cardiovascular disease. We have amazing chapters on um, and then we even have chapters on leaving a legacy, on we have an amazing chapter for us Americans who have health insurance on how to use health insurance. We have a chapter written by, I don't know if you know Susan Bratton.
Oh, I've
Um,
interviewed her as well. Yeah.
yeah, yeah.
Mm.
So she wrote an amazing chapter on how to please a woman. Um, so all sorts of really cool chapters on everything you really need to know to be healthy as a man.
Mm. Yeah, so we've had a few people in common then on this podcast. I interviewed her, How to Age Orgasmically. That was the title of our
Nice.
conversation.
Yeah, Susan's great.
Yeah. And what's the quote that you live by? Quote or affirmation that you live by?
Oh,
Be nice to people.
yeah. I mean, that's one of them. Roll with the changes.
Mhm.
Maybe, life's going to change. You just have to be ready for it.
Okay, is it you referring to age or what kind of changes?
Everything,
Mm.
you know, what they say, the only thing that's permanent is
Constant.
change. Yeah, the only
Yeah.
thing that's constant is change.
Okay, great. Well, hopefully the erections go up and down, so
Yeah,
but it's been
exactly.
improving. So where can people find you?
Oh, let's see. So, if you're interested in P-Long,
Mhm.
penile enhancement, it's p-long.com. If you're interested in my medical practice in Northern California, it's brandeismd.com, brandeismd.com. If you're interested in my book, just go to the 21st Century Man, all written out in letters.com. And if you're interested in Affirm or any of our other men's health supplements, go to Affirm Science, AFFIRM Science.com. And then I have a YouTube channel, which is Brandeis MD, and Instagram, which I don't even know what my Instagram is. If you look up my name under Instagram, I'm sure it shows up.
Yeah, I think
Um,
I'm following you. Yeah.
yeah.
So you answer people's
But
questions a lot on it. I saw on your Instagram or
sometimes,
yeah, yeah,
there's only so many hours in the day.
yeah.
I do a lot of stuff.
Great. So what you so where can people find you? So that's it. So thank you so much for enlightening us all about the penis. It's been
Awesome, Venus. And next
interesting.
time I'm going to do the podcast from one of my favorite cities, Barcelona.
Oh yeah, for sure. I can take you
Yeah.
to the erotic museum. They have a 7 foot penis.
Really?
Yeah.
Nice. All right. You know, he started actually as only 7 inches, and it was one of our P-Long success stories.
Okay. This is like 7 foot. So yeah, that'll be extra. It's a wooden one as well. Yeah. Because it's actually this erotic museum. It's to commemorate the day of the penis in Japan or something like that. There's a
Oh,
day of the
really?
penis. Yeah.
Nice.
So yeah, it's very religious in different parts of the world. I know some people who are Indian who have these lingams, these penis statues, worshipping them. Amazing.
Great.
So thank you so much for
Well,
joining
thanks
the
for having me on.
orgasmic lifestyle and where every day is a climax.